It is my great honor and pleasure to introduce Sue Hassmiller, whom I lost my glasses along the way, so I'll just tell you what I know about her personally. Oh, there you go. Yeah. What are you going to say? This is the consummate advocate for nursing. She has a title, I believe it's Senior Advisor to Nursing. Oh, there it is. Advisor for Nursing. I made her Senior Advisor and Director of the Campaign for Action. But she is the individual who is, I don't know how she does it, this tireless advocate, not just on behalf of the Robert Wood Johnson Foundation, and her leadership there is legendary, but on behalf of nursing, and most especially on behalf of the goal and mission of the foundation to improve the health of the public. And I really think it's that vision and energy and her ability to understand how it is that we have to have moving parts here. We have to have moving parts on building science and programs such as INQRI. We have to have real investment in positioning nurses at all levels to maximize their contributions, to do the things that they are so beautifully equipped to do if we give them the right environments, if we create the right expectations, if we create the right path. And so that work on the campaign for action is, I know, what she'll be talking a great deal about. She, of course, was separated, I think, for a couple of years from the Robert Wood Johnson Foundation, loaned to the Institute of Medicine when an unbelievable landmark report was produced that all of you in this room know about, that helped to chart a path for all of us in terms of the future of nursing, the IOM report and the future of nursing, and now is engaged in the really tough work. And when Zeke today was talking about the bumps in the road, I'm sure that there's no way that you could talk about the movement that is going on in terms of implementation at state levels, in local communities, at the federal level, in the work in antitrust, in everything, keeping all of those paths moving toward a common goal, I'm sure, is replete with bumps in the road. So there's nobody better to keep us all focused, cheerleading all of us on in our efforts to make this happen. So let me welcome this tireless, courageous, imaginative, I don't know, but I think I did better without my glasses. Thank you.
I totally agree. That was so refreshing. Thank you so much. You know, you get to a point where somebody else reads your degrees again. It's like, that was so wonderful. Thank you, Mary. And this is such a cause for celebration. I am so happy to be here. I tell you, it was, I don't know how long ago it was, but I've been at the foundation for 15 years, and I came to the foundation from HRSA, the Bureau of Health Professions, having worked on primary care, national, international policy, and really interprofessional kinds of stuff, and physician workforce development. So I was brought to the foundation really to work on primary care and physician workforce development. And it was really after, 5 years of being there that the nursing shortage was hitting, and I thought, wouldn't it be great, because our mission is to improve the health and health care for all Americans, wouldn't it be great to have at least some kind of report or stake in the sand that nurses are really important in all of this work as well. So we produce the report called Healthcare's Human Crisis, the American Nursing Shortage. And that was really the start of everything at the foundation. And then I remember it was very early in my president's tenure. She had just gotten there, and I wanted her to hear from nursing. I don't know if you remember this, Mary, at all. So I gathered to the foundation, I think about 25 nursing leaders in this country, to talk about what we ought to be doing at the foundation. What a great invitation, right? And I do remember that there were a lot of things talked about, and at the end of the day, we were sort of all over the board, and I remember sending out this Survey Monkey to the 25 leaders who were there, saying, okay, you know, we talked about all of these things, and these are things that are important to you and what you think the foundation should focus on, and let's really get a sense of priorities here. So, you know, that priority list, and at the top of the list were things like ensuring that nurses, you've all heard this one, right? It's sort of a general one, ensuring that nurses have a seat at the table, or are in important leadership positions. But at the top of that list, too, was please do something that would create a link, and that's about as far as that went, that would create a link between, damn it, what nurses do and quality of care. The link is just not there in people's minds. Well, in some people's minds, it's not there. And then I remember, I have water, thanks, Michael. Thanks. And then I remember there was a priority that said, and when you do something about this link between nursing care and quality outcomes, make sure there is a way that you translate that so that people really understand. I just got goosebumps thinking of that time and INQRI and what INQRI has done for the foundation. And when I talk about INQRI's legacy, it really is to say congratulations to Mark and Mary. What an incredible job that you have done. And Heather, I don't know where you are in the room. But, you know, foundations are funny places. I'm not even to my slides yet. But foundations are funny places. They love it when they get on, they have an idea, or maybe someone has given them this idea, and maybe those people are out in front a little bit. But it's like, okay, this is what we're about. This is the foundation's idea, and it's going to be our cornerstone. And it's going to be about interdisciplinary and quality and everything. And, you know, Mary and Mark have really done that, and we're so proud of that. And you'll be able to see that we have built on INQRI, the lessons that we learned. And I'm going to go on here. Let me see. The lessons that we learned in INQRI have served as a cornerstone and as a roadmap for a lot of what we do in our nursing work at the foundation. And, you know, Don Berwick is not the only one with triple aims, right? So, you know, here's INQRI. And you've met all of these aims. Your research shows that nurses, and that was the plea from the nursing leadership community. And I think this is really it, right? Your research shows that nurses can improve patient quality care. And some people would say, duh, but here you go. Patient care will be improved once your research is adopted into practice. And that's really important, and I'll talk about that a little bit later too. But really including stakeholders in that research translation is critical, and something that this program is really known for. And as I said, you've really influenced RWJF strategy. And here are some lessons. There are three lessons that I sort of drew from this. And I really have four, but the fourth one is not in here, but it's in here. And I'm going to talk about that in a minute too. But interdisciplinary collaboration. We are all about interdisciplinary collaboration, interprofessional collaboration at the foundation now, for a variety of reasons, but because of INQRI as well. You know, the idea at the beginning was there are nursing researchers and there are other kinds of researchers. And wouldn't it be terrific, right? Because our premise is if you can bring those two sides together, they can influence each other and they can broaden each other's perspectives. And the nurses can learn about what the sociologists are doing and the economists, and the economists and the sociologists can really understand and bring into their own literature the nursing work. And that's what happened. That's incredible. That's incredible. So that's what engaging other professionals is about. And also the exchange of the importance of methodology and clinical insights across the different professions has been very, very important for this program, and something that we've taken on into other of our programs because of INQRI. And, you know, I'll go back and forth a little bit between what INQRI has done and the lessons and sort of what I'm doing now. But for those of you who don't know about the report, and there may be, Mary, you assume that everybody knew about the report. For those of you who really don't, it's a report that came out called The Future of Nursing, Leading Change, Advancing Health. It was an IOM report. It came out in October of 2010. And my good colleague, Andrea Broussard, brought these recommendations. If you really haven't had a chance to flip through the recommendations, I'm sparing you the entire book. But you may want to take a look at these recommendations, and we brought wonderful color hard copies for you today. But it was so important as we had this body of work in the IOM report, which, by the way, if you're new to the report, it is breaking all kinds of records at the IOM. It has remained the number one reason, Mary, why people go to the IOM website. It is the number one printable document. It's the number one sold report since October 2010. So it is striking a nerve, so I would encourage you to take a look at the recommendations at least. But here's where we are at. You know, we've watched INQRI, the very importance of bringing different perspectives, different groups together to forward an agenda. So important with our campaign. Now that we have this incredible body of evidence, it's about translating that. It is research, right? It's about translating that research and getting it out there, engaging stakeholders, and really, essentially, it's getting these recommendations adopted, isn't it? That's the goal of the campaign, if I were to have one sentence. And how do you do it? You can't do it with nursing alone, and that's the message of INQRI as well, and that's the big message with the campaign. You cannot get this work advanced with nurses alone. Nurses are central. They are the leaders. They have the content expertise, everything. But the way that we're going to do it is by engaging and using and bringing these people to the table and actually working with them to advance this agenda. And in some ways, I call that channeling Florence Nightingale because, right, when she did all of her work, she knew very well that, and it was a different time. Granted, it was a very different time. She was a woman, and women weren't supposed to do certain things. But even at that, she had an incredible body of evidence and literature and ideas. And she needed royalty and military leaders and business leaders and policymakers. Really, she used all those people in order to get to where she got to in those days. And we're doing the same thing. We're looking at INQRI, we're channeling Florence Nightingale. Lesson number 2, we have to keep up with this evidence. Yes, certain things can, get biased and get changed without some evidence, but not generally. Not generally. The IOM report is nothing but evidence. That's what makes it so great. That's what makes any IOM report great. And that's what INQRI has really made a stand to say as well, that evidence is key. The translation is important, the stories are important, but you gotta have the evidence first before you can tell the stories, can't you? Don't you? And we have that. We have 40, is that right, Mary? 40 INQRI projects. And it's not to say that we didn't have it before, but now we have this body of literature, and people with a message saying, we have the link now. That group ever so long ago, we answered you. We answered you. We have this body now. We have this message. And that's the legacy of INQRI. Here's the report. For those of you, I think most of you probably have seen it, but for those of you who haven't. And we highlighted some INQRI projects in the report, and you can see some of the INQRI projects that we did highlight. We used a lot of INQRI evidence. We heard testimony from people in the year and a half, 2 years that we were in session. So your work really counted for quite a bit as we've gone along in our work at the foundation. And as I mentioned, you know, the IOM report is a body of evidence. It is a body of literature. And we have research questions, just like anybody does, just like you all at the end of your research studies, there are questions yet unanswered, aren't there? And that's the same thing that happened to us, same thing that happens with any IOM report. So in the spirit, and I feel so grateful and just very grateful, because how many IOM reports, not to mention reports in general, and you know, we looked at so many reports before we went to the IOM to see what makes a successful report, what's going to make this work in the end. Personally, I didn't want to be involved in this if it was going to sit on a shelf, right? And the thing we learn, that's another great thing about foundations. We do studies to look at studies, you know, we study everything. But we did a study to figure out how we were going to do the study, right? We did. That's the truth. And, you know, this person came back and said, and he looked at a great deal of studies, and he said, you know, you got to get a great chair that's believable, that's high level. Okay, check, Donna Shalala, right? Great staff. We had wonderful staff at the IOM. But the number one thing, he had like 10 or 12 things that you must do to have a great IOM report. But at the top of the list, what was it? Can't let it sit on the shelf. You got to have a plan. You get just, right? Isn't that what INQRI is about? You have to have a plan. And that's what we did. And I am so grateful to be part of this plan now and directing this incredible campaign that I cannot believe, with very little money on the backs of thousands of volunteers that were doing this. And getting back to the research questions, there were a lot of research questions left undone. If you know anything about an IOM report, you can't make a recommendation unless you have evidence, right? That's what the IOM is about. And, you know, I kind of sweated some of those recommendations. They just wouldn't let them be published, and you just had to say, but there's more evidence, I'll get it, I promise, there's more things to show you. But there were things left remaining. And what we did, and this is Lori Mellick, I don't think, she's probably with her little baby somewhere, but Lori was our research director for this IOM process and really kept track of those questions, and at the end said, we've got to do something with these questions. So based on the content areas of the report, you know, advancing education and practice and scope of practice and diversity and leadership, we said to folks, we had an RFP, answer some of these questions. What are you interested in? What can you answer for us? And we cannot promise that we're going to fund all of this because we simply can't. But we know other foundations and funders who might be interested. So we did a request for proposal, and many of you submitted proposals answering these key, very important questions. And we had a panel of judges, reviewers, who looked at these proposals that came in, and then some of them made it through the review process, and now they're posted in a funders community on our website so that funders can come and see what aligns with their own mission, which is what foundations are about. It's all about their own mission, right? But they're encouraged to come to that website to see what these incredible researchers have done, and they're ready. They're ready out the door for you. This is really efficient. So you should go to that site if you're interested. You know, I can help you with that afterwards. But we're just committed, and now the INQRI office is managing that process for us. So very, very important outcome. And then finally, and we talked about this a little bit, the importance of translating research into practice. I remember attending one of the first or second INQRI meetings, and it was Mary and Mark's idea and Lori's from the beginning to engage stakeholders. That was always part of their plan. They knew, I mean, they're very seasoned researchers and really policy people as well, right? So they know what it takes to get things not only in journals, but into legislation. And so I remember being at one of those early INQRI meetings, and there were stakeholders, right? And some of the INQRI researchers presented their research, and then the stakeholders just lit into you. I remember that, lit into you. I don't think that's right. You shouldn't say it this way. And I remember thinking, oh my God, what a process, right? But I hope it was helpful. I really do hope it was helpful for you, and I have to believe that the reason why INQRI is so successful and their legacy of translating research into practice, that process really worked. And, we've used that. We use it on the campaign with stakeholders. What do you think? Here's a business case. How does this read for you? Is this going to really fly in your hospital? This is really important stuff. You shouldn't even be engaged in research unless you know who your audience is and who your stakeholders are, and you have a plan for getting it there afterwards. And that's INQRI's legacy. And just a little ladder to say that when nurses are given the skills, and not only the nurses, but others as well, but when nurses are given the skills and then are encouraged to use those skills, and they know their audience, and the organizations adopt those recommendations, that's when patient care is changed, and that's what we're here. That's what we're here about. And I'm going to mention the fourth lesson learned for me, and it's not up here. And that's the importance of. I'm so glad that we have INQRI, and I'm sure everybody has, at least a master's and probably 3 PhDs after your name and lots of credentials. But here's what's really important to me. What's really important to me, another message, is to say that it doesn't take our kind, PhDs, MDs, CCR, whatever, all your credentials, it doesn't take all that to be a researcher. I really want the message to get out. This is so critical as we have the IOM report and as we're trying to get this message that this is about all nurses. We all need to be better prepared to take care of patients, not just PhDs or advanced practice nurses, right? This message is for every single nurse. That's why I love transforming care at the bedside. One of our early works at the foundation after this illustrious group of leaders came to us, right? For those of you who don't know about TCAP, it was a wonderful national program for frontline nurses. And what TCAP said was to nurses on the unit and others that they worked with, this is your unit, this is your environment, these are your patients, these are your tools. You ought to come up with the solutions about how to do all this better for better patient care on your unit. And these were nurses of all kinds, not PhDs and all the credentials. So my message, my lesson number 4, is we've got to find a way, while we're translating it for important policymakers, we've got to find a way, as faculty, many of you are faculty, to really instill in your most basic students, BSNs or whatever, your most basic students, that you are responsible, you are accountable to your patients, to your healthcare systems. You have just as much a right in coming up with solutions in this country as the next person. It's on your shoulders. If you think it can be done better, then you should study it, track it, try it out, and implement it and get the word out there. So that is also my lesson, and I'm encouraging all of you to take that message and really feel it, take it back to your schools, take it back to your organizations, and be a mentor. We can all be researchers. If that word is too intimidating for people, you can all be solutions makers, and it is your responsibility. And that should be a legacy of inquiry. Let me see, back to the campaign. Many of you know that our wonderful leader, which I am so excited about, is AARP. And what a great co-brand that is, because, you know, and I say this so often, the Future of Nursing report, yes, it does have the word nursing in it. The campaign has the word nursing in it. But honestly, this is about patient care. This is about improving the patient care in our country. And the co-branding was so important to us because, you know, RWJF, improving the health and healthcare for all Americans, and knowing that nurses are at the, you know, the front lines of quality. I'll just put it that way, right? And then AARP, the branding of consumers and patients. And we love that because what that means is nurses are there for patients, and patients can depend on nurses for their care along the continuum. And it's very, very important to us. And we're so happy that, you know, I've been in this business for a very long time, many decades, as many of you have been. And, you know, I'm happy to see what's happened with this report, with this roadmap, if you will. I see nursing organizations coming together like they've never come together before, and that's a great start. I love it, and I say that's a great start. When you have university faculty and deans coming together with community college faculty, and you have to do that because academic progression is a very important recommendation to us and the foundation, right? And they're coming together, nurses are coming together on many different issues that they've not come together for before. And that's great, and it's a great start, and I love it, but there's more. There are those other stakeholders, there are those other people that we talked about, and it's central to this campaign. It's central. And here's our map. Here's what our map looks like lately. This is our network. We're doing a lot of things with the Center to Champion Nursing in America at AARP at the national level. We have a lot of stuff going. I won't even get into one of them. But there's so many things going on at the national level. But this is so great. This is like a real campaign. There's a national, you know, there's like campaign headquarters, like in Princeton and Washington, D.C. And then we have all of these campaigns going on. And the states, yes, they had to apply, and there was pretty stringent criteria, and part of the criteria was that they had to have these other partners, but at the crux of it, it's up to them. They got to look at the report, and out of the 42 recommendations, they got to say, based on their own state needs, their gaps, their healthcare challenges, the interest of their committee, they got to say what kinds of recommendations they wanted to work on and where their focus would be. And now we have 48 states, and we'll get these other two. Don't worry about the blue states. I know everybody's worried. Why? Why is Oregon? What's happening in Alaska? I know. But we'll get them, but the beauty is that they are working on that, and there is focus now In many cases, as they're telling me as I travel into the States, there is focus now around an agenda, and people know where to go, and they know who to include, and they know why they're doing this. And I love this vision, because this vision speaks to what I have been trying to say the entire time. The first part of it is just like any other mission or vision that any of you would have in any healthcare system, but the second part is so important, and it says that all Americans have access to high-quality, patient-centered care in a healthcare system where nurses contribute as essential partners in achieving success. You have helped convince people of that second part. All of you who have been intimately involved in INQRI have been involved in that second part because you have said there's evidence. We know what works, we know what you ought to do, and here's the roadmap, here's the evidence. And it's, you know, probably not a bad idea to have a nurse at the table in addition to all of our other colleagues to help you get there. So, your work counts. Have I convinced you enough that your work counts? All of these things, and much more, you know, things that you've done, fewer patients experiencing falls, medication errors, hospital readmissions, patients receiving better care, care coordination, chronic care management programs. You have given the answer to those leaders who came to the foundation and said, why can't there be something in this country that can link nursing to high quality care in this country? And you should be very, very proud of yourself. So persevere, that's what it's all about. This is, you know, it's interesting. My mother lives with us, and I was making a joke with a colleague. We were emailing back and forth, and I was sitting in my mother's bedroom, and my colleague on email was saying, you know, I think I'm really good at this, this, and that, and, you know, we just had this silly little conversation going. And instead of saying what I thought I was good at, I turned to my mother. I said, Mother, what should I say that I'm good at, right? This was the first word out of her mouth, right? And boy, you just have to persevere no matter what. There are, Zeke Emanuel was right, and Mary was right. You know what? I'm so happy that we have this report, and people are very happy. People are saying it here. Thank you for that report, right? But even the report brings out others in our world that if there weren't enough roadblocks before, this may have stimulated even more roadblocks. And so perseverance is really the key, right, to leadership with all of us. We just cannot give up. I really, truly believe this is a historical time in this country. Yes, I'm going to just go into my little world here. Yes, it's because of healthcare reform and the Affordable Care Act, all of that stuff. But can I just take one moment to say that I'm just so happy that we have this report for nursing as well. And I think it is a historical time and a transformational time in our country for healthcare to make things better for us, our families, and our patients. And I would say all of these things to you. Continue to conduct and translate your research, both. It shouldn't even be an and in there. It should be just one word, conduct, translate, right? It's only one word. Your research, so policymakers and the public really do understand much of what we come up against in our world is that translation. We constantly have to work on that. Be tireless in broadcasting the link. Fabulous start. We got to keep going. This incredible link between nursing and high quality care. You know that there is much work to be done on that one. Develop and set policy agendas. Do not wait for people to set these agendas for you. Do not wait. You have done the research, you have the evidence, you're all leaders. You need to be setting that agenda and telling people how to set that agenda. Do not let that agenda be set for you. Be a mentor. And this goes back to what I was saying before, how strongly I feel about this research and evidence thing not just being an elitist master's or PhD thing. We should be mentoring all of our students in basic research methodologies, data collections. Again, they are solution makers, they are accountable and responsible. That is what you should put on their shoulders. Be a mentor. If we do all of that and much, much more, we are going to ensure that this entire campaign succeeds. Here's where you can, I won't read all this, but here's where you can reach me. You won't see me really twittering. Sometimes they make me Twitter, but you know. Anyways, on Facebook, you will see me on Facebook and online and different things. But thank you for all of you do. Keep doing it. Congratulations, Mary and Mark. We are so proud of you at the foundation, and onward and upward to all of us. Thank you.